Hello and welcome. I'm so glad you're here with me. We're going to be talking about something really personal today, and I just want to start by making this a really safe and supportive space for us. Together, we're going to gently explore that connection between what you feel in your mind and what you actually experience in your body.
So, let me ask you this. Have you ever had that feeling, that little whisper of intuition, that the discomfort you're experiencing goes deeper than just a physical thing? That maybe your stress or your worries or even things from your past are all part of the story?
Well, I want to tell you something right here and now. That intuition, it is absolutely right. What you're feeling is not all in your head. It's a real, physical experience, and you 100% deserve to be heard, to be believed, and to be understood.
Okay, so let's gently dive into the why behind all of this. We're going to explore the amazing and, yeah, complex way our minds and bodies are so deeply connected. And this isn't about blame at all. It's about understanding how your body is intelligently trying to protect you and how sometimes that very protection can lead to pain. It really all starts here with your autonomic nervous system. You can think of it as your body's own automatic control center. It's the bridge that connects how you're feeling emotionally to how your body responds physically, without you even having to think about it. Now, your nervous system kind of has two main settings. On one side, you've got the fight or flight mode. This gets switched on by stress or fear, and it causes your pelvic floor muscles to tense up and it blocks arousal. But for comfortable, pleasurable intimacy, your body needs to be in the other mode, rest and digest. That's the state where you feel safe, relaxed, and your body can actually welcome pleasure. And this is what happens physically when you get kind of stuck in that protective, high alert state. You see, stress and trauma don't just live in our memories, they show up in our bodies as real, measurable responses. Hypervigilance keeps you on guard. Your pelvic muscles can tighten up automatically. That's called guarding. Natural arousal gets reduced. And here's the kicker. Your brain can start to anticipate pain, which can make the sensation feel even more intense when it happens. This whole situation often leads to something called the pain-fear avoidance cycle. And for so many women I talk to, learning about this is a huge light bulb moment. It's a totally natural loop your body learns to protect you, but it's a loop that can really keep you feeling stuck. So let's just walk through how this loop works. It might start with just one experience of pain. Your brain, trying to keep you safe, creates a fear of it happening again. Then, in anticipation, your pelvic floor muscles involuntarily tense up to guard you, which, unfortunately, often leads to more pain. This just reinforces the fear, and pretty soon avoiding intimacy can feel like the only safe thing to do. Does any of that sound familiar?
And this brings us to a question that I know can be so hurtful, so deeply invalidating. It's a question that might have made you feel totally misunderstood or alone in what you're going through.
Let me be perfectly clear about this. Absolutely not. The pain is physical. The original trigger might be rooted in stress or something emotional, but the result is happening in your body. We're talking about real nerve signals firing and real muscle spasms. Your pain is 100% real. Period. So, now for the most hopeful part of this whole conversation. If the body can learn this protective pattern, it can also unlearn it. So now we get to shift from understanding the why to exploring the how. Let's talk about the gentle, proven path to healing and breaking the cycle for good. You know, healing can begin with really small, gentle steps that you are in complete control of. It could be as simple as practicing some slow, deep breathing to calm your nervous system. Or maybe it's actively choosing to replace any self-blame with just a gentle curiosity about what your body's trying to tell you. It can even mean just learning to notice where you hold tension without any pressure to fix it right away. And it is so important to be patient and really kind with yourself because healing has a biological timeline. Think of it like starting a new program at the gym. The first few weeks are all about brain training, retraining that communication between your brain and your pelvic floor. Then, over the next couple of months, the actual muscle fibers start to adapt. For pain that's been around for a while, it can take a few months for your nervous system to really unlearn that deep fear reflex. It just takes a little bit of time and consistency. While those first steps are so powerful, please hear me when I say this is not a journey you have to take by yourself. In fact, finding an expert guide who really specializes in this area can make all the difference. They can provide a safe space and a clear, supportive path forward. And this is exactly why I'd love to introduce you to Dr. Farzana Khan from the Women's Health Clinic. She is a medical doctor who has dedicated her career to this very specific intersection of women's health, our emotional well-being, and our physical comfort.
Her expertise is just so deeply reassuring. I mean, we're talking about over 2 decades of experience as a medical doctor. She also holds a specialist diploma in sexual and reproductive health. Her entire clinical focus is on helping women with these exact concerns: vaginal health, sexual function, and creating comfort. She even trains other doctors in this area.
And this is her philosophy of care. What this quote really means for you is that you'd be an active partner in your own healing. It's all about you truly understanding what's happening in your body, setting realistic goals together, and making decisions that feel right for you, every single step of the way.
So I want to leave you with this gentle, hopeful question. And this isn't meant as pressure at all, just a quiet invitation to yourself. After everything we've talked about today, what could your very first, maybe very small, step toward rediscovering comfort and pleasure look like? Whatever it is, please know that you are so deserving of pleasure and that healing is absolutely possible.